So if someone came in with a laceration, I would come into the room, I would wash my hands and introduce myself as a nurse practitioner student. I then would assess the extent of the laceration. With a laceration, you really want to make sure before you close it up with sutures is to make sure that any tendons or ligaments weren't ruptured in the laceration. This one being right index finger, I'm going to be assessing the right index finger. I'm then going to talk about suturing to the patient. This is going to be a bedside procedure that will require a general consent. While explaining this to the patient, I'm going to basically say that I would be cleaning the site, I would be numbing the site with 1% lidocaine, and then I would also just explain that there are complications because the patient already has broken the protective barrier and exposed microorganisms to the inside of her body. So there's going to be risk for wound infection, wound breakdown, delayed wound healing potentially, persistent swelling, or even a suture reaction. I then would go and grab my supplies. I'd come back in the room, wash my hands again. I would put on clean gloves. I would scrub thoroughly the patient's laceration, around the laceration with good soapy water. I would then take a flush and try to flush the inside of the laceration to make sure there's no dirt that remains there before it's closed. I would then take a chlorhexidine wipe and wipe for 15 seconds around where the sutures will be, just to make sure it's as clean as it possibly can be. I would then take 1% lidocaine and I would inject that all around the laceration into the fatty tissue to numb where the suture and needle will be going through. I would then open a sterile field. I would open up the sterile scissors and the instruments for suturing onto that field. These are the only items that are going to be sterile in this process. Clean gloves are okay in this situation. And then lastly, I would provide the patient with post-suture education. For this patient, I would educate that I want the bandage that I'm going to place to stay on the patient for 24 hours. I want them to not open the bandage. I want them to keep it dry. Then on that 24-hour mark, I want them to begin washing the incision in the sutures gently with soap and water 2 times a day and placing bacitracin over it for 48 hours, remember twice a day. And I would have them place just gauze and tape over that. And after now, starting on day 3, into the 4th day, because we've done 1 day where they don't touch it, 2 days of the bacitracin. They can then just gently wash it with soap and water and leave it open to air. And then at day 7, I want to do a follow-up and consider taking out the sutures if I agree that it's appropriately healing. I would provide the patient with education of signs of infection that include redness, tenderness, nerve pain, swelling, pus around the incision. Then I would tell them that they would need to come in immediately to the clinic and be started on antibiotics. And this concludes my suturing demonstration. Thank you.